up, you guys? I'm Dr. Nick. Thanks again for clicking on this video, and I want to take this time now to thank all of my new subscribers for joining this channel and following along with all these videos. We're halfway to 100,000, so please make sure you're sharing these and we keep the interest going, and I will keep posting more videos. I'm trying to do my best to answer a lot of the questions that my subscribers have and respond to the types of surgeries and videos they want to see. So let's get started with this video. This is actually a patient of mine who was a pizza delivery guy, and he was having pain to his great toe, wasn't sure what was going on. It had been present for several months, which made him think it wasn't an ingrown toenail, because ingrown toenails, most people think, occur suddenly, they're infected, there's usually pus and redness. In this particular situation, the patient had suffered from this for several months. It was painful in his shoes. He thought something was just wrong with his toe. So let's take a look, let's watch and see what's happening here. So we're getting started. These are our instruments. We have them set up right next to our procedure. That was a 62 blade I'm getting ready. Now we're using a freer, and look, we're going into the area on his toe where he was having pain, and you can see the nail kind of looks deformed, and he had a deformed ingrown toenail with just a mild, like subclinical infection, we can call it, or a chronic infection because of the curved nail pushing into the skin. So we're going to permanently remove this side of the toenail. We're starting our cut right there, and we're deciding how much of the nail we want permanently removed. So once we get that cut started, we then come back and we'll get a 62 blade. You may have seen me talk about these in some of my other videos. We use that 62 or chisel blade to then cut the rest of the toenail, and we're going to extend that all the way under the cuticle, or what we refer to as the eponychium. And now we're going to see how big this piece was. So we're getting some bleeding. That's controlled with a tourniquet. A little bit of bleeding is normal. And I'm going back in because I didn't feel like I went all the way through the toenail. You want to make sure you get all the way through. And now we get our hemostats, and we're going to remove this. Let's see how big this thing is. This is growing all the way into the corner of his medial nail fold of the great toe. And you're going to see, look, there's a little spike there. This is that classic ingrown toenail spike that I always talk about. And that's what was causing a lot of his pain. So the chemical that I'm putting on now on this cotton tipped applicator is phenol. That's going to stop the nail from growing back. It ablates, or as my patients will say, it cauterizes the nail root. It's not really cauterizing it, but we're creating a chemical burn to stop the nail from growing back. And we're going to do 3 applications of this chemical solution. And it's actually more effective than to surgically excise the nail matrix, because you can't see or visualize all those cells with your eye. So when we use the chemical, it bleeds out and destroys or ablates those cells that grow the toenail. So we're getting all the way under the cuticle area. We want to make sure we're getting all those cells. And we do 3 applications, and that helps to ensure that we ablate all those nail cells. So the patient will then get bandaged with Neosporin and gauze. That large bandage will stay on for 24 hours. The next day, this patient will be able to return to work with just a Band-Aid and some Neosporin. I usually have them soak their toe with the gauze on the first time they soak it. And we say 24 hours later, but if this procedure was done in the evening or early afternoon, the next day in the morning, they're fine to take their gauze bandages off. And as I said, I'd usually have them soak it first, because when they soak it, it kind of softens it up and it won't adhere to the bleeding soft tissue where the nail is removed from, and it comes off a little easier. So if you have something like this done, you can work the next day. I let runners run immediately the next day. It's not a very debilitating procedure. You can return to work, like I said, the next day, resume all your normal activities. You can even go swimming after a couple days. Actually, the water is good for this to help keep all the debris and dirt out of it. So thanks again for watching this video. You might want to click on some of these other videos I have posted here. Please make sure to put the notifications on so you see when I post new surgical and educational videos. If you have any questions, drop them in the comments section below, and we'll see you soon.